I said yesterday that I was going to post the content. I actually was able to do it before lunch since I dismissed you earlier from lab. And I showed you the folder. I put it in there while you guys were watching. But then I added these. It's 5 parts to the content. Like I said, the cell membrane one is a little long. I could maybe break it up a little bit, but I think everything in there kind of goes together. And then there are the other ones. I asked you to, if you could, be sure to watch the cell membrane one for today. It's possible that we won't get to the cell membrane material within today. It might be on Thursday. But if the rest of what I want to do today doesn't take up the whole time, then we'll go to dealing with the cell membrane first. And then also we want to address protein synthesis, which we'll definitely not really concentrate on until next time. And then the rest of it isn't anything that we're going to deal with in the material that we're dealing with in class, but it is stuff that you're responsible for knowing. So it's there, so you have a kind of lecture version of it to deal with. And I expect to sort of do the same sort of thing for future material. So you should expect in the week 4 thing to see a folder with the online content, and so on and so forth. I'll number them so you can kind of, if you were going to watch them all together, you'd sort of progress through them the way that the lecture would go. But if you want to just go to a particular topic, you can just watch that one by itself. So more on that.
The computer stops playing the audio from like section 13 to 16 in the cell membrane. I don't know, maybe my computer just changed its mind, but I watched the whole first part and then it wouldn't do the sound anymore.
Did it sit on that slide for a while before moving on, or did it like show you the slide and then a couple of seconds later move on to the next one?
It just sat on it, so I hit the arrow, and then it started just showing like all the way through and stopping.
Oh, with no audio? Okay.
It could have been just me.
It was the endo and exocytosis part.
Okay, so
Why did it say that?
it could be that the audio is technically not in that portion. And if that's true, that end part isn't terribly crucial.
No, like the exo and endocytosis ones wouldn't play.
Right. So it might be that when I was putting all together over the weekend, I was doing that at the hotel where I was, and their Wi-Fi signal was a little iffy sometimes. So it might have been that I thought I'd uploaded that audio, and it actually didn't go. So I'll go in and check again, and I might have to add that audio stuff. But yeah, that exocytosis, endocytosis, exocytosis, that stuff at the end. It's important to know that it exists, but it doesn't impact, again, what we're going to be doing exactly today. So, if you could just send me a text or an email just reminding me of that, so I'd love to get to that as soon as possible, but I'll probably forget before I have time to. So that brings us to what I want to deal with today. And while we're on the unit or week 3 material, unit 3 material, which is the cellular level organization, I'm actually going to go to a different folder for a little while to sort of show you where we're going to get the basis of what we're doing this week, which is going to be the week 6 folder, which is the practical exam. And I want to talk a little bit about the practical. So in a laboratory science course, there's a special kind of test that's given for the laboratory section, which is called a practical exam. For a class like anatomy and physiology, it's based on kind of the classical or traditional approach to a lab anatomy course, which can best be described sort of with medical school as an example. Now, I know you're not going to medical school, but this is kind of where it comes from. So in medical school, the students take an anatomy class called gross anatomy. The word gross in that context doesn't mean disgusting. It's actually from the German word gross, which means big, as opposed to micro. So microanatomy is what you see through the microscope. Gross anatomy is what you see with the naked eye. And so what they do in medical school is they dissect a cadaver and they see all of the parts. They take things out and see what's in and deeper inside. And then they're tested on that, possibly in a number of different ways, but sort of the classical or traditional way is the students that have been dissecting a cadaver, there might be 4 working together in a lab group, meet with the instructor at some point when the test is being administered, and the instructor basically points to things in the cadaver and the students have to name what it is. And that's just testing their ability to recognize and know the names of certain things, essentially. Taking that approach for a course like this, the practical exams that I used to give, and many of my colleagues here give still, are kind of the same idea, but instead of course, having a cadaver, we have models and specimens like what we look at in the lab. And usually what that would entail, and so imagine we're in the lab room, and how the tables looking there. So on the front table, there'd be, 4 or 5 stations set up, maybe all 6 seats there on the front table. And each one would have maybe the torso model or a bone or some other model or a microscope or something like that laid out. And either you have an answer sheet that's just a bunch of blanks that you have to write words in on, or it's a multiple choice fill in the bubble kind of sheet. And so you go to the first station, and there might be a piece of tape pointing to something on the model, and you might have to just write into the blank what the name of that thing is, or there might be a multiple choice question next to the model that you have to answer and fill in a bubble and a answer sheet or something like that. And you move from station to station, and each question's there. Now, when I started teaching kind of formally, my first position when I was a graduate student was to help teach medical students the neuroanatomy class. So they take gross anatomy where they learn about the whole body, and they don't do anything with the brain or nervous system in that course. Well, the central nervous system in that course. And they take a separate course, which is neuroanatomy, and I helped with that. So they had a separate lab where they got the brains out of the cadavers and they dissected those and got to know the nervous system a little bit. And so I was part of making a practical exam for the students that they could take usually the day before they had the actual test that the professors for the course put together. And so myself and the other TA had to sort of make up this test. We did it. And it was very regimented, which is to say they had like 30 seconds or a minute and 30 seconds, I can't remember anymore, at each station. And so we were there saying, watching a stop clock and saying, okay, next station, and everybody would move over, and they'd have that much time to answer the question, and if they're done before the time was up, they had to sit there or stand there and wait till it was over so they can move on. And I think some of my colleagues here still, take that approach to testing. I've moved away from it for a couple of reasons. One, setting up that kind of test is very time intensive. It's very unusual, the anxiety around, you've got a minute to look at this thing and answer the question and move on. And everybody's sort of moving from spot to spot, and it can be pretty intimidating. Students usually do very poorly the first time they take a test like that. And that's why I was doing the practice version for the neuroanatomy course. So they had a practice one and they sort of screwed that up. And when they took the real one, they did better because they were used to that type of test taking. It's just not feasible for me to set up a practice exam like that and then set up a real exam, the next day or whatever, and especially do that for all the classes that I'm taking. So just the time commitment to run that kind of test is a little more than we're suited for here, or I'd like to work with. Also, the other reason why I don't like that kind of test is because I don't think it's really appropriate for students in this course. For a medical school, those students, it's not entirely useful anymore as the field has changed, but it's more appropriate for the doctors to kind of be able to recognize and name things in the body like that. But unless you're going into surgical technology, you're not going to be dealing with the body in that fashion. You're more likely going to be dealing with patients who are, one, not dissected, and two, alive. And so you really need to approach the body in a different way. So I do the practical in a very different sense. I've sort of reinterpreted it. The word practical in the classical sense is just that you're taking a test with the materials that you studied from, I guess is some way of interpreting it. But in my sense, practical means sort of real world situations. And so the test you're going to take is based on case studies. So what we're going to do today is, and Thursday, is look at a particular case study and get a sense of how to use this sort of thing in a class like this. And also from this particular case study, we'll get to learn a lot about cells and molecules, which we just studied, and then tissues, which is our next topic. That's all sort of tied into this particular case. The mechanics of how the test works, how the practical works, which you'll be taking, obviously, October 19th, yeah, that would be right. That's the Monday of whatever week 6 we're doing that in or something. You'll come in for lab that day, and I'll hand out, I don't think I have a copy of it, but let's pretend this is it. I'll hand out to you a stapled sheaf of papers that have the test on it, sort of a traditional sort of thing. It's the only test or assignment that you have in my class that's in that sort of, printed out sort of test, but we're going to do it there in class. And you'll sit down probably where you do every week and complete it in a fairly normal test-taking approach. I can't remember if I said this now. That's 50 multiple choice question test. And then there's another component of it, which is an online assignment, which is the thing that you see right here, this assignment right here. Both of those are based on case studies. And in this folder, which is meant for you to go into to get some information to prepare for the test, as well as complete the online portion of it, There is a document here that says cases. And on this document printed out are 4 case studies. Okay? We're going to be looking at one of them in some detail today. But with these 4 case studies, we're basically going to cover the material for the first half of the semester. Case 1 is sort of about what we did the first week in lab, so to speak, with the directions how we describe where things are in the body and the body cavities and that kind of thing. That's what that case is meant to address. What it is a athlete, I guess, playing football, fell and injured himself. And it might not be evident from the case as it's written, but I want you to know what's happened is he's injured an internal organ. And so the point of the case is for you to think about where that injury took place and which cavity that injury was in. So that kind of goes with what we did the first week. The case 2 is the one that we're actually going to be looking at in more detail today and continue on Thursday. And it's going to be a big case that really kind of spans the chemistry, molecule stuff that we just finished, the cells, which is kind of the main point of it. And then it gets into thinking about tissues, which is our material for next week. And then the other 2 cases, numbers 3 and 4, are about broken bones, which is after we finish tissues, we're going to go on to, well, the skin, which is kind of a minor part of this class, and then the skeleton. So those cases kind of address that. Now, the way that the test really works, the 50 multiple choice portion of it, on the the thing that I hand out to you, it'll start off with a place for you to write your name at the top, and then it'll say case 1, and it'll have exactly what you see here on the test. Okay, you'll have this to look at and prepare for ahead of time, but when you come in and take the test, what you've had to work with will actually be on the test. You won't have to memorize the case or anything like that. You'll have it there to refer to. Of course, you'll have prepared a little bit, and I'll explain how to prepare in what we're doing today. And then it'll be followed by roughly 12 or 13 multiple choice questions that are about that particular case. And then it'll say case 2, and it'll have exactly what's here for case 2. I actually have a printout version of that case so that you have it to refer to today for what we're going to do. But that'll be on the test. And then it'll be followed by 12 or 13 multiple choice questions. Then it'll say case 3, and we'll have case 3 on it, followed by its questions. And then case 4 with the case printed there, and then its questions following that. I say 12 or 13 questions because there's 50 questions total, and 4 does not go into 50 evenly. So that suggests that there's going to be 12 or 13 questions per. It might not be exactly 12 or 13. It might be 11 in one and 14 in another or something like that. But it'll all equal out to 50 total. And so thinking of it as being about a dozen questions, those questions kind of fall into 3 groups as I like to describe them. The first is what I would call a question about the case. And I'm going to explain to you today how you need to read these cases and get the relevant information out of them. It's a fairly simple kind of process. And I'll expect that you have done that for all of the cases that are on the test, so that when you come in and take that test, you have that information ready at your disposal. And so there will be questions along those lines. And then the second type of question out of the dozen or so is questions that are not about the case. Now, that might seem like I've covered all my bases, either questions about the case or questions not about the case. But what I really mean by that is these cases are very specific stories about clinical situations, but they're within the context of something that we've done in the class. So case 1, for instance, he's injured an internal organ. And as far as what the case is about, I want you to concentrate on what body cavity that organ is located in, or where things are located and how we describe it. So if I'm going to ask you questions about the case, I'm going to be asking questions about where that organ is in the body and where it's positioned relative to other things. And then questions that are not about the case are really questions that are about other body cavities and other terms to use to describe where things are. So still staying within the context of that unit, so to speak, and just giving me some latitude to ask you questions beyond that. And then the third type of question is the more traditional kind of practical question. Instead of having a whole room set up with things that you have to look at and answer questions about, I'm just going to have a few things set up. Actually, 2 things per case, so there will be 8 things that you'll have to get up and look at. And they'll be up on the outer countertops in the lab, so you'll be sitting at the tables and you can get up and go over and look at something, answer the questions for that. And I'll have pieces of tape on the models or whatever you're looking at, and you'll have to identify what the piece of tape is pointing at and then answer a question based on that. Sometimes there will be 4 pieces of tape labeled A, B, C, and D, and you'll have a question. The answer will basically be which of those 4 pieces of tape is pointing at something that answers the question. Or there will be just 1 piece of tape and there will be a question about whatever that piece of tape is on. What is it? What does it do? How is it important to the case? Something like that. So those are the 3 types of questions. It's not an even distribution of those. It's not like there are going to be 4 about the case, 4 not about the case, and 4 traditional ones. It'll be more like 8 to 10 of the questions will be about the case, and then 2 or 4 will be about something else within the unit that the case is about. I want the cases to be the focus of the test, but I don't want to give up the possibility of asking you questions about other things related to that. So again, the example, the first one, that it's sort of about a particular body cavity, most of what I'm going to test you about is going to have to do with that cavity, but I do want the latitude to ask you questions about other things that aren't on the case, and so there will be a few about that. The traditional sort of looking at a station or looking at a model and answering questions, I try to make those about the case as much as possible. But sometimes there's just something that's more appropriate as that kind of question, but it's not about the case. Telling you more than that, you kind of have to take the test and see what it's like. And then the online portion, again, the assignments right here in the folder, there's 16 more questions. And as you can see here, you might not be able to read it from where you're sitting, but it says questions 1 through 4 cover case 1, 5 through 8, case 2, 9 through 12, case 3, 13 through 16, case 4. So 4 questions more about each case. Those questions are more like the part 4 questions, open-ended, maybe fill in the blank, but more open-ended kind of questions that you'll ask. And those will ask you to think a little bit more deeply about the case. So that first one, again, it's concentrating on, you should be able to figure out from the case what organ's been damaged, and you need to think about which of the body cavities that's in. That's the point of that case for the multiple choice stuff. And then the online assignment is going to ask you questions delving into the case a little bit further, which will probably require you to get online and do a little bit of research about what the question's asking or that sort of thing. The multiple choice questions are worth a point per. So there's a 50-point test. The online one, those are each worth 2 points per, which totals 82 points, so 50 1-point multiple choice plus 16 2-point open-ended comes out to 82. The test is actually out of 75 points, which means that there's like 7 extra points built into the test, which will be extra credit if you earn them. If you get 76 or up through 82 points on it, those are just extra points that go into your lab score. Honestly, people don't tend to get that high of a score on the test overall. So more of those 7 extra points are there to give you a little bit of a buffer. If on the multiple choice stuff, that type of test is a little bit still hard for you to become accustomed to in time to earn the grade, there'll be basically 7 questions that you can completely mess up and it won't have an effect overall. You can still get 100% on the thing. The online assignment here, those questions, they're worth 2 points apiece, like I said. They're kind of like part 4 assignment questions, which are 6-point questions. Now, when I have 6 points to use to grade a question, I can be a little bit more particular about how I grade it. If you're right on and you get the question correct, you get 6 points. If you're pretty darn close, but there's just one thing that's not quite right, like I don't know, there's not a question like this in the introduction part 4, but if I ask you a question about the positions of certain organs to each other and you explain that, but you got superior and inferior wrong, it was clear that you understood what was going on, but you just put the wrong word in there. I want to give you full credit because you obviously know things, but I've got to take a point off because you messed up a little bit there. Or I can give a finer gradation of points for 6 points. But when it's just 2 points like these, essentially 2 points represents that you thought about the question and answered it appropriately. 1 point is that you might not have really seemed to understand the question. You were in the general area, but didn't really read it closely and answer it how it was asked. And then 0 points if you're just completely off. And that kind of approach really means that I could get 12 different versions of an answer for that from all of the people in this class. I think there's 12 total. And everybody gets 2 points on it just because their answer satisfies my expectation that you've answered something that addresses the question and makes sense. So there's a little more wiggle room in the grading for that. People tend to do quite well on the online portion of this test. It's not unusual for people to get 30 or 32 points on that part, and that can really help out overall. And so those extra points that I was talking about really do kind of represent some wiggle room in how you might screw up a few questions on the multiple choice part without really suffering a whole lot. You could get 38 of the questions on the multiple choice part right and still get an A on the test overall. Okay, 38 out of 50 is 76%, which sounds like it's a nice round C, but 38 points plus 30 points is 68, which is actually basically an A minus, and then 38 plus 32 is 70, which is definitely an A on the course, on the test. So it's possible to suffer a little bit on the multiple choice thing and still bring it up with the online part. Now, I say things like that to students, and sometimes they say, oh, I'm going to get an A on this test. But implicit in any kind of statement like that is that you have to do the work, okay? Sure, more students tend to do really well on the online part, but you shouldn't just assume that you're going to do well on that. You have to put the work into it. So I'll remind you of that when we get closer to it, but I'm just trying to illustrate how the test works. If you're interested in looking at the online assignment, like a Part 4 assignment, you can open it up, save your answers, although I don't suggest you answer anything just yet, but and then open it up again later on. So if you wanted to, because you're curious, open that assignment up and look at it, it'll officially be saying that it's in progress, but until you hit submit, which you probably won't do for a few weeks, you have access to that assignment. You're welcome to look at it if you want to. So that's an idea of what the practical exam's like. I used today just to illustrate that a little bit, to describe that a little bit so that you have an idea of what's coming up. I will say a few other things about the practical as they come up when we're talking about things in lab over the next couple of weeks, but I want to describe it here because we're going to be looking at cases. And what I want to do next is sort of tell you about the kind of 3-step process of getting information out of these cases. Now, the point behind using these cases is to help you understand how the basic anatomy and physiology of a course like this applies to a real-world situation. Now, these are clinical cases that we're talking about. These are stories about patients in real-world situations. They aren't necessarily real cases. Some of the ones that we're going to work with are, but some of them aren't. But they're all written as if they were. And so by reading through the story here, you'll be able to pull information out so you can see how what we're covering in this class relates to a real-world situation. Now, you may have a particular plan in mind what you're going to do. You might go into nursing, as the majority of students are interested in doing. You might be headed for dental hygiene. You might be headed for surgical tech or respiratory tech or PA school or something like that. The cases that I use are generally straight medical cases or surgical cases, which is the more common medical fields, maybe best suited for nursing. I don't have any cases that are really for dental hygiene. I actually keep meaning to work with my dental hygienist to see if she can help me develop a case, but one problem with working with your dental hygienist on something like that is that it's really hard to talk when you're in the room with her because she's got her hands in your mouth. But she's expressed some interest. We just haven't had time to actually hammer out the idea. So someday that might happen, but not this semester, certainly. So I want to describe kind of how I would describe getting the useful information out of these. Now, I have this up on the screen. I'm going to type it in as opposed to writing it on the board because I am capturing this lecture on for the computer. And so this way, people watching this will see what I'm talking about as I type it up. So the first thing that you need to get out of the case is that you understand the terminology, that you know what it says. And by terminology, basically, I mean definitions of the word. If there's a word that you don't understand, you definitely need to look it up. But a couple of important points about this, considering these are medical cases, you need to understand the jargon that's in there. Now, my go-to example of what I mean by this is not probably anything that anybody actually has a problem with, but let's pretend. You know what the word blood means and you know what the word pressure means. You wouldn't have to look up either of those words by themselves because they're common words you're used to. But when they're used as a medical term together, blood pressure, it means something very specific. Now, I imagine you all probably know what blood pressure is. And you might not have to look that up. But that counts as sort of a jargony term. Oftentimes in science, those sorts of jargony terms are constructed in a less than grammatically perfect way, which is to say that it's usually two nouns together. like blood and pressure. But the first noun, blood, for instance, in this example, is actually modifying the second noun, like it's an adjective. An English teacher, grammatician, or whatever you'd call that type of person, would not like that kind of construction. It's just not the way that you're supposed to use nouns. Okay? Now, it is the way that nouns sometimes get used, especially in creating kind of jargony phrases. It's not just for science or medicine. You can see them other places. If you've ever heard the term task force, that's two nouns, and if you ask what type of force it is, it's a task force. Oftentimes, especially when it's like corporate speak, where you're trying to sound like you know what you're talking about because you're somebody's boss, but you really don't know what you're doing. Those kind of jargony terms are usually fairly meaningless. Okay, is there other types of forces besides task forces that do things in corporate or business worlds or something like that? It's kind of meaningless. So if you see two nouns together that you might recognize what they mean individually, but in context you don't understand what they mean side by side, it might be that that's a specific term that you need to look up. Now, you might know what blood pressure is, but you are expected to know, what's important about blood pressure, what the normal value for that is, if the case doesn't say it expressly, and how that compares to whatever value is reported in the case, that kind of thing. Okay. The third thing you want to keep in mind with terminology is about abbreviations. In medicine quite a bit, and other specialized fields, abbreviations get used a lot. In medicine, especially writing up medical charts, abbreviations are very useful because they save a lot of time writing things down. So they get used quite a bit. You need to be sure that you recognize what the abbreviations are, what they mean, and especially what they mean in context of the case. It's possible to come across an abbreviation and you look it up and sort of, you do a Google search or something like that for it, and the first explanation of the abbreviation comes up, the most common usage of it isn't relevant to the case that you're using. So pay attention to that. In A&P2, there's a case I used at the beginning of the semester that's about a disease called pure autonomic failure, which is abbreviated PAF. I have a question in the practical, I think it's in the practical, about that case that asks something about the disease PAF. And so I know there are a lot of students that look up PAF, and a more common usage of that particular abbreviation is for paroxysmal atrial fibrillation, which is not at all related to the case that that question is about. And so if somebody answers that question based on that other abbreviation, they're going to get the question wrong because that's not what the question's about. So pay attention to what the abbreviations mean and make sure that you understand them in the context of the case. So that's about terminology. If you understand what you're reading, then you're going to get information out of it that you need. Then the next thing is what I refer to as symptoms and signs. Now, a symptom technically is what a patient complains about, what the patient is coming into the doctor's office about. And then signs are things that are discovered about the patient's condition, oftentimes that the patient's not aware of. So if a patient complains about their chest hurts, or they can feel their heart racing or something like that, that would be considered a symptom. But if it's discovered that the patient has high blood pressure, the patient's not going to say, well, I feel hypertensive. You just don't have a conscious perception of that kind of thing. But you can discover it from doing the test. That's kind of what the two words mean. I don't really care about that distinction. What I'm talking about here really is the compromised functions. What's going wrong in the case? Okay, that's what I really am talking about here. And so it could be a patient complaint. It could be test results, which are kind of the two major definitions there. But you can also think about what is evident from any histories, meaning personal history, medical history, family history, those sorts of things might be explained in the case. And they can have a bearing on what's going on. Okay. Another thing to pay attention to is medications. When somebody's on a particular medication, it might mean something important for the case. They might have been taking that medication for a long time. They might not say something specifically about it, but being on a medication means something. You know, somebody might take Advil on a regular basis, but not really think about, you know, terribly important why they're taking it. But why are they probably taking Advil? Yeah, they have some sort of pain. So the fact that they're taking Advil might suggest that there's something going on that they might not have reported out because they're kind of managing it because of what they're taking. I use Advil as an example, which of course is a non-prescription medication, but there are prescription medications that can tell you something about that, about what's going on. And then the third thing that, so in taking this approach, what you're doing basically is the story that is the case that you're looking at. You're pulling out of that what's wrong with that person's body, what it's not doing correctly. Okay? And then the third thing that I want you to look at is what systems are involved. And by this, I mean the affected organ systems, which is to say, for a symptom or whatever that you've found, any compromised function in the case, you want to tie that to the organ system that's responsible for that particular function. Okay. I don't have things to list under this. It's just really the list of symptoms that you have. You just tie each one to a particular system. So this is a good way to go through these cases and get the relevant information out of them. So what I want you to do is take a look at this case. I'm going to hand it out. It's case number 2 in the first practical set of cases. But it's a little too much to put on the screen for everybody to read. It's sort of like 2 screens long. So I'm going to hand it out. You'll have a printed copy of it. I'm going to give everybody some time to look over this. And feel free to discuss what you think is going on in this case a little bit with the people around you. And then we'll discuss this case in terms of what I've got on the board here. Okay, you might not have gotten to read through it all completely, but we're going to talk about it sort of in this context, and so everybody should get an understanding of things. So we'll go ahead and make a list of the things that people need to understand. Now, when I first started doing this with this case, which is a bit much of a case maybe, there are a good number of terms that people don't probably know offhand and they'd have to look up. And I want to talk about those. You may have looked them up. So as you're reading through it, if you came across something you didn't understand, you might have looked up. People nowadays tend to have internet-capable devices and they can Google a word real quick. So you might have done that. But I want to try to cover those things. So what terms did people not recognize, whether you looked it up or not? Go ahead. Okay, so I'm not going to actually put that here because while it's important to know and look that up, that's really the point of this case. So we will end up sort of defining what that is in a very complete sense by going through this case. But yeah, that would be certainly something that you might want to look up.
Exacerbations.
Yeah, so exacerbation. Does anybody know what that means? Yeah. So she's going into the hospital because she has cystic fibrosis, but she's always had cystic fibrosis. She's going in because the symptoms are getting worse. Okay. So exacerbation just means essentially getting worse. Okay. What else? Oh, purulent sputum. Well, let's take those apart. So there's purulent and there's sputum, which together mean something, but it's not jargon in the sense that I was describing before, because purulent is actually an adjective. It's modifying sputum. Okay. So does anybody know what purulent means? I'll take that as a no. It means pus. Okay. And does anybody know what sputum is? Correct. It's what you're coughing up. When somebody has a cough, sometimes it's referred to as a productive cough because they're producing something, they're coughing something up. And so sputum is what you're coughing up. So purulent sputum, therefore, would be describing the fact that somebody's coughing up pus. Okay, so along with the phlegm or mucus or whatever you want to call it. Actually, let me add mucus in here. So phlegm, mucus, whatever's being coughed up. Okay, what else? Okay, hyperglycemia. Now, I talked about looking at the parts of words to understand what they mean when we were talking about those lines and the down the pelvic cavity. And this is a good place to do that. So what does hyper mean? Yeah, above or high. What does glyce refer to? Sugar. Yeah, sugar. What does eem mean? In the middle of a word, the root is em, but when it's at the beginning, it's hem. Sickness. No.
Blood.
Blood, right, like hemoglobin. And what does IA at the end mean? That's where you were kind of going.
It's like pertaining to.
No, it actually specifically means condition, okay, or disease state. So hyperglycemia basically means above or high sugar blood condition. Okay. Now that's a very awkward way of saying it, but really what it means is, well, high blood glucose. And yeah, you would see that for someone with diabetes. Now, diabetes is a diagnosis in its own right. So she has hyperglycemia because it's a complication of the cystic fibrosis disease. Okay. What else? I think it's pronounced agaphany. And honestly, I'm not positive what the word means because doesn't it say something like no agaphany, something like that?
Yeah.
So it's not crucial to the case, but I do kind of know what it is. It falls into a class of respiratory sound. So it's respiratory sound. Specifically, if I remember correctly, it's during speech production. Now, to say a respiratory sound, what I mean by that is what you hear through a stethoscope as you listen to the lungs. And so agaphany, if I have it correct, is if you have somebody speaking while you're listening to their lungs with this, what do we call it? Stethoscope. Then you hear some whooshing, crackling, whatever kind of noises in the lungs when they're producing speech. I think that's what it means. And it might actually not be in the lungs. It might be in the throat region. But it's not crucial to the case because it's not actually present. And that's a fine distinction that's not terribly important. But that's what it means. What else?
An acronym at the bottom, HEENT.
Right. So again, you need to be aware of what abbreviations mean. This abbreviation is a little bit more, obviously, than just ENT, but ENT is part of what this is. Do you know what ENT stands for in a medical sense? You know, a doctor that specializes in ENT? Is that referring to? Ear, nose, and throat. Okay. So if you're going to expand that to be HEENT, and notice that that abbreviation is under the physical exam portion of the case. It's referring to the fact that a physical exam of the structures described by this, so there's the ear, the nose, and the throat. So what do you think are two things that one starts with H, the other starts with E, that would be examined along with when you look at the ear, nose, and throat?
Eye.
So the other E is for eye. What's the H for?
Head.
Yeah, the whole head. Okay, so HENT is just head, eyes, ear, nose, throat. Okay. That's what I was throat. Throat. Okay. What else?
PH.
Oh, NPH insulin. So insulin, you probably recognize that, but NPH is referring to a specific type of insulin. I actually don't really remember what it stands for, which is not important. It's basically a drug name. And I have to look at it again to remind myself. So she's taking NPH insulin before breakfast. And then she's also taking Lispro insulin with each meal. So actually, let me put NPH versus Lispro insulin. This is referring to, I think they're called slow-acting and fast-acting insulin, which is to say she takes NPH in the morning, and that helps to regulate her blood glucose levels for the 24-hour period. And then when she's going to eat a meal, she takes Lispro to deal with the spike in blood sugar levels that you get for that meal. And it's not uncommon for hyperglycemia to be regulated that way. So that's essentially what the two are. I don't know what NPH actually stands for, but and sometimes in class I say that and somebody looks it up on their phone and they say, it's not terribly important what it actually does stand for. It's just the idea that it's two versions of the insulin drug, one that's taken once a day, one that's taken before every meal, essentially. What else?
I'm not really sure what peptic ulcer disease is.
So peptic means referring to what?
I have Pepto-Bismol, but that's not
So when you take Pepto-Bismol, what are you taking it for? Which means that it's which organ?
your stomach.
Right, so peptic is referring to the stomach. And then what's an ulcer?
Inflammation in the large intestine.
Well, it doesn't have to be large intestine. It's just a site of injury, a sore. I guess you could say, yeah, there's inflammation associated with it, but usually it's damage to tissue. I mean, really, you could say that a ruptured pimple is an ulcer. Okay, it's a sore also. Kind of a disgusting sounding one, but you know, skin diseases kind of creep me out anyways. Oops. So peptic ulcer disease would just be a condition that causes sores in the lining of the stomach, essentially. Okay, what else?
I need to understand the list of the other medications.
Say that again?
The rest of the medications.
The rest of the medications. Well, we can just start at the beginning. What's the first medication listed there? Well, the first one that's listed there is pancreolipase. Now, when you see a word that ends in ASE, the ASE tells you that it's what? It's an enzyme. And so you look at the rest of the word to figure out what that type of enzyme is. Now, really, the enzyme that we're talking about here is called a lipase. Okay. So what do you think a lipase is going to break down? What is LIP short for? Or the root of? Lipid, right? So lipases are enzymes that break down lipids. What is the pancreas part of the word referring to? The pancreas. Okay. Now, most of the digestive enzymes that you have breaking down food in your small intestine are actually made by the pancreas. So pancreolipase is just referring to the specific lipase that comes from the pancreas. Okay. That's all the word means. It's in parentheses right after the word pancreolipase, it has the word creon, and that's just the trade name for a particular version of that enzyme, okay, that she takes. Okay, okay, so we covered the insulin things. And then the next one after that, now that we've gone back and picked up on pancreolipase, then the next thing is Prevacid. This is a trade name brand name that I mean of a particular drug. And I really kind of like how this name was invented, let's say. It has the word acid in it, okay? And what it is it's to treat heartburn, which would be when stomach acid is causing problems. What do you think the prev part of the word? Yeah, it prevents acid. Okay, so this is just an antacid drug. I actually don't remember offhand what class of antacid it is. There's some types that block acid production at the source, and there are some types that neutralize the acid in the stomach after it's already been produced. So like Tums or something like that is a neutralizing agent. I don't remember where Prevacid falls in that group. I think it's the other type that blocks acid production, but it's been a while since I actually looked at it. Okay, so then after Prevacid, the next thing listed there is itraconazole. Does anybody know what that is? Every so often there's one student that's heard of it and knows what it is, but I'll take that as nobody knows. This is an antifungal, which is like an antibiotic, but antibiotics target bacterial pathogens. Antifungals obviously target fungal pathogens, like a yeast infection or something like that. I don't know why in the list here it says itraconazole and then it doesn't say antibiotics until after the next one. It would make sense to put those two together, but they don't. And instead, the next one is Flovent. Does anybody know what Flovent does?
Asthma.
Yeah, it's an asthma medication. That's not how you spell asthma. So that runs through the terminology that you probably don't know. Oh, sorry. Well, first off, any others that people want to ask about? Usually people ask what albumin or hemoglobin or those sorts of things are. Collectively, I'm not going to define each one individually, but collectively, they're proteins that the liver makes. So it's essentially looking at that. But then finally, there's FEV. Anybody know that offhand? If you didn't ask about it, then you obviously knew what it was, right? It stands for forced expiratory volume. Expiratory, exhalation, kind of the same thing, but it's expiratory is a particular word there. In testing somebody's respiratory capacities, one of the things you'll have them do is, exhale air through a tube, and you'll measure how much air they're exhaling. And in this test, I don't know why, but in this particular case, there usually is a subscript after this, like FEV1 or FEV50 or something like that. The 1 would refer to 1 second. The 50 would refer to 50%. And so the value that you'd see for this is how much air you exhale, forcing it out of your lungs, either over the first second of emptying your lungs, or how long it takes you to exhale 50% of your lung capacity. I assume that there's not a subscript here because the value that's provided is, in fact, 50%. And so that implies that she's exhaling 50% of her lung capacity in a given time. And if you're going to do a time test with this, it's usually over a second, I think. But that's what FEV stands for. And it's a point of what's going on with her case here. So that kind of covers the symptoms. The terminology. Now we want to think about what symptoms there are. So what symptoms are described here? Okay, so the most obvious thing right off the bat, she has a cough. What else?
Shortness of breath.
Yeah. So I'm going to put shortness of breath along with cough because they're kind of related. And that's shortness of breath, not the other thing that SOB stands for. What else?
High blood sugar.
Okay, so there's the hyperglycemia. What else?
Sputum.
So she's Producing purulent sputum. What else?
Uh, cystic fibrosis getting worse.
So that's not a symptom of its own. Actually, all of the symptoms we're talking about here add up to that. So we'll hold off on talking about cystic fibrosis itself. But what else do we see going on here?
Weight loss?
So she has what's actually pointed out here. She has a low BMI, okay, which is just a ratio of height to weight, which can sometimes be a slightly more useful number to look at than just plain weight. Okay.
She had like a low appetite. It didn't say that specifically. It said it improved.
I thought it did say low appetite.
It says her appetite improved.
Oh. Okay. Let's leave out anything specific about that because it actually, we'll find out later on, it has to do with the BMI thing. So what else?
She has a fever.
Okay, so she has a, well,
Temperature of 101.4.
now, I'm not going to put that up here because what we're looking at are compromised functions. And when you have a fever, that's actually the sign of a function working the way it's supposed to work. Okay. Why does she have a fever?
Because her body's trying to fight off whatever sickness she has.
Yeah, so she has an infection. So that's actually the immune system doing what it's supposed to do. In illness, oftentimes what the immune system is doing is going to seem counterproductive to, being healthy, but it helps to get that way. But what do we already have that tells us that she has an infection?
The mucus.
Right, so the purulent sputum, that's the sign of infection there. And so the fever is just the body's attempt to fix that. So I'm not going to put that on the list because we want to look at the compromised functions. If you were in a medical situation, you're considering this case, then the fact that her body temperature is abnormal is something that you would have to take note of, but it's really a sign of things working the way they're supposed to, considering what's going on in our body. Okay. What else?
Increased heart rate.
Okay. What is her heart rate?
It is 110.
And what's a normal heart rate?
60 to 80.
Yeah, usually 60 to 80 is the normal resting heart rate. It can go up to 100 with a little bit of exertion, but over 100, especially if somebody's not exerting themselves, is a sign of an abnormal heart rate. What else?
High blood pressure. Oh, we have that. Just kidding.
We do?
No, we don't. High blood pressure.
Oops, that's not right. Okay, what else? Well, so we were just talking about the fever, and we're going to leave that off the list because it's not the sign of a compromised function. It's actually the body doing what it's supposed to do.
Wheezing.
Okay. Yes.
Cystic fibrosis exacerbation.
Well, that came up earlier. All of these symptoms are that exacerbation. And so we'll talk about what cystic fibrosis is in context of what all these mean. What else?
What's a polyp? I should ask that earlier.
Yeah, that really ought to come up in the terminology thing. What is a polyp? I'm going to go back and put that in here. Anybody know what a polyp is? So if you're a marine biologist, a polyp is a type of organism that lives on a rock, kind of like a sponge. But medically, when there's a polyp in the body, what it is it's a growth of mucous membrane. So where is this polyp?
Right now.
Yeah, so she has a nasal polyp, which means that there's the mucous membrane on the inside of her nasal cavity is got a little growth in it. Okay. Now there's more to this, more symptoms here. So we'll continue on with this discussion on Thursday, finish out talking about the case. I had said, be familiar with the cell membrane stuff for today. We obviously didn't get anywhere near talking about that, but it'll be part of what we do on Thursday. We'll also touch on protein synthesis on Thursday also. So keep this stuff handy and we'll finish this discussion. Whoops.